right, well, moms have the big job in the delivery room. They are going through painful labor, which could last hours and hours before the baby arrives. So how can dad and partners advocate for the mom so she can focus on the job at hand? Thank you for staying with us. I'm Erin LeBeau.
And I'm Tamsin Vidal. With the answer to that question, we are bringing in the director of midwifery at ULA, Casey Selzer. And Casey, thanks so much for being with us this afternoon.
Thanks for having me. Happy to be here.
Well, so most dads don't know much about what really goes on during labor and delivery. It's not like what you see on TV all the time. So how can they get that real sense of what it's like ahead of time?
Great question. We always recommend at ULA that partners accompany the birthing person to all of their prenatal visits. That's a great way to get to know the care team and start to ask your questions in real time. It's always good to just go deep in education. So whether that's reading books, there's a great book called The Birth Partner by Penny Simkin that we recommend. Taking a comprehensive birth class and just talking with other new parents. The more you learn, the better.
Okay, so what exactly can a partner do to help keep mom more comfortable during this process?
So, when it comes to reducing pain in labor and being more comfortable, we know that the ways to do that are to reduce fear and to reduce tension. And so partners can build, we kind of think of it as like Mary Poppins a toolkit, right? Like all different tools in that toolkit and specific tools that can help to target that. So whether it is taking a class, asking questions of the care team, advocating for what's important to the birthing person, or to reduce tension by learning massage technique, or drawing a bath for your partner. Anything that you can learn and practice ahead of time. I always give a 5-minute bedtime routine. Practice the tools that you're going to use in labor to support your partner, and that will really go a long way in remembering what those tools are and being able to do them well in labor.
Yeah, I can imagine in the midst of everything, it goes out the window.
I have to imagine.
Can't remember. Yes, make a list and check it twice.
All right, so let's talk about this because we do see this oftentimes. Partners timing the contractions. Should that be the job? One of the jobs.
Love this job. Yes, they love this job. They're enthusiastic, and we love to see it. And I think when you've gone through labor, as I have 3 kids myself, you lose a sense of chronological time. So we rely on our partners to remember time, right? But there is that sense of watch pot waiting to boil. So remember, the job is not on the app on your phone or writing down the time. The job is being in real time with your partner. So yes, it's important, but that isn't the only job. And sometimes we need to step away from that and think about kind of the big picture.
Don't forget what you're there for, right?
Exactly.
All right, so you mentioned you're a mom of 3, so you've been through this a few times. So what other ways can a partner or the father kind of advocate for the mom?
Yeah, I think, it's really important for partners to lean into that role of being, I call it like communication chief, and to really reach out to the care team and be that communicator. When I'm in pain, I sometimes can't remember or think of things that are important that I need to uplift to my team. And so I rely on my partner to be that bridge in communication. So whether that's working with a doula, working with a midwife, working with an OB, and making sure that you understand all of the risks, benefits, and alternatives of decision-making that's happening in real time in the labor experience, partners can really own that role.
Is there anything you can say to prepare a first-time parent for the labor and delivery process?
So I think where you choose to give birth and the type of care team that you choose, like for example at ULA, we're building collaborative care that is midwifery driven, that really centers the patient. Wherever you land for your model of care, that is going to dictate so much of your experience in the birth. So do your research early in the process to really think about what's going to be a good fit for you. And then I also think working on developing a birth plan, which is a tool that helps to communicate and build trust around your preferences, goes a long way as well. And the last thing I'll say is prepare for after the birth. I think postpartum, the 4th trimester is the forgotten terrain, and it is so critical. As much as birth is a huge transformational event, the real adventure begins, and as I'm learning, it never ends on the other side. So start thinking about that during your pregnancy journey.
Absolutely.
All right, well, thank you so much for joining us and shedding light on this important topic.
My pleasure, and you can find us at ULA Health on Instagram.
All right, Casey, thank you.